Hello and welcome to today's webinar about steps to connecting holistic practices to reimbursement. My name is Kelly Noftel and I am the Chief Administrative Officer at ABC Coding Solutions. And also presenting today is Melina Giannini, and she is the CEO and founder of ABC Coding Solutions. Melina, would you like to tell us more about your background and about the company?
Sure, Kelly. Over 20 years ago, two friends and I started this company with the overriding question, how do you get alternative medicine paid for by insurance? And that grew into how do you get non-physicians paid for by insurance, because doctors had plenty of codes to file claims to insurance companies, but the rest of the professions out there, which was over 2 million providers, had no codes to say, here's what I did, here's what you need to pay me. So our first task as a company was to fill the gaps in the coding systems that were available to practitioners, and next to help determine which practitioner was allowed to offer which service in which state. And we'll talk more about that later. Kelly?
So in today's presentation, we will be discussing the steps involved in our practice setup process. But I also wanted to mention before that, that we had a previous webinar that's connected to this webinar. And if you missed that, we've included the link in the description of our YouTube video. And you can also subscribe to our YouTube channel where you'll get future webinars that we do, and previous webinars. You can have a list of those and check those out as well. So our practice setup process, there are 5 steps involved. First, getting started, we'll be collecting documentation from you and information about your practice. And the second part is the practice assessment. That will help us determine the third part, a strategic plan that we'll develop with you and have your approval on before the fourth step, which is implementation of that plan. And then the last part is the services included after we set up your practice.
Sure. The next thing that we're going to do with you, if you decide to work with us, is we're going to define the scope of services you need, and we'll establish fees for those services. We also offer a practice setup package of a fixed fee if you'd rather go that direction. Then we execute a consulting agreement and we attach the service and fees as an addendum to that contract. And then anything you want to change later is another addendum to the contract. You pay the initial fee to ABC Coding Solutions. Then we hand you an online questionnaire, have you fill it out, and then we ask you to upload documents that you have into Dropbox. Next. Our online questionnaire takes about 15 to 20 minutes for you to complete. It's really easy. And it does the following things. It benchmarks your workflow for us. That helps us understand how to save you time and money. It also helps us determine your compliance level. So if you have any risks, we can mitigate those risks as we go forward with our work with you. Next.
I'll talk about this part. We'll ask you to upload documents into a Dropbox folder that Melina had mentioned. Now, this Dropbox folder is HIPAA compliant, it's completely secure, and it's only accessible by us and by you. The items that we'll ask you for are your contracts with current insurance companies, a list of your diagnostic and procedural codes that you use, and we review these for accuracy. Any patient handouts or forms that you give patients in your office, we'll also review. If you use a current Superbill, we'd like to see a copy of that as well. And lastly, any vendor contracts.
So the purpose of this review is we want you to be able to pass an audit if anyone walks into your practice before you ever bill, so that your practice is secure, you're doing things correctly, and you're not at risk of having anyone come in and stop you from billing. We work around your revenue goals, and we want to know what would make you happiest, what kind of work makes you the happiest, so that you have the biggest chance of having a great experience with this assessment. We also submit a strategic plan for you. That plan is changed with your approval if there's something in it that you want to do differently. Once we have joint approval of the plan and it's approved by both parties, then we manage the implementation. And that's where Kelly comes in, because she's expert at project management and she makes sure that everything that's going on is being done timely. We provide a weekly status report to you, and the practice controls the speed of implementation. So if you want to have this assessment done quickly, get the information to us quickly, we'll get it back to you very timely, and then we will be able to move this along quickly. If you have a lot of work at the practice and it takes a long time for you to come back with the things that we need, it's going to take longer to do this project. And you know, the rate is between 1 and 3 months. Next, please. One of the things that I bring to the table is that I am pretty expert at talking to insurance companies. I understand their underlying motivations and their problems and issues. So I initiate communication with any insurance companies that you want to do business with, or ones you're already doing business with that you want to expand out into more alternative services. I understand how to follow insurer guidelines, and I would also establish a pre-certification process for any initial claims, which will tell me a lot about what the insurance company expects from us. And we don't file a lot of claims until we've done this work, so we avoid having you get out into the market incorrectly. We try to solve the problems ahead of time. The other thing that we do is we review your CAQH ProView account. If you don't have one, we strongly suggest you get one. And the reason that CAQH is a starting point for any insurance reimbursement is that 90% of the market is using that as their starting point to determine if you're a practitioner they want to do business with. So Kelly's going to scroll through the list of companies just to show you kind of how many there are. And you're not probably going to run into a company that doesn't use CAQH ProView as a starting point for dealing with any insurance company. They want to know who you are. You're trained to do what you say you're trained to do before they're going to refer or pay for claims for your patients. Thanks, Kelly. We can get out of that. Finally, I was talking earlier about legally billed for services in scope of practice. You may not realize this, but there are over 18 million different references that we would use to determine who's allowed to do what in which state. And that's because all state laws are different for any practitioner who's not a medical doctor or an osteopath. Excuse me. So one of the things that we're unique in is that we understand that about your practice. We know what to do about it. We know how to code for it. And we also know how to teach medical billers and others to work with the information that we're going to provide. And then we can help you leverage COVID era changes to billing and coding, so that if you want to have more of a virtual practice, we can help you do that. Next, please. This is an example of a practitioner who had gone on to get his NPI number and had first of all said that he was an internal medicine DO. And that was the only information insurance companies saw about this practitioner. So we go into the federal site where this information resides, and we make sure that the insurance company sees everything you're trained to do. And so that's part of the first thing that we'll do to your practice to expand billing. Next, please. Then after we have done the assessment of where you are, we then start customizing your Superbill. And Kelly, could you take that, please?
Sure. As Melissa said, we create a super bill for you and with you. And those on the previous slide, as you saw, those taxonomy codes with that practitioner's MPI, those will also appear on your customized super bill. And this assures accurate billing for your full scope of practice. We'll review a sample super bill in just a moment. It also allows you to code a patient visit in 3 minutes or less, so you're spending more time with your patients and less time taking notes or on your computer. It also enables better documentation after the visit, and it accurately ties documentation to billed care. I'm going to go ahead and click on the sample super bill, and I'll turn it over to you, Melina.
Okay, great. Thanks for blowing that up. Right under the header, you'll see some numbers and then the word acupuncturist, nutritionist, nutrition education, massage therapist, and kinesiologist. Those are that indicates that this practitioner has additional certifications and training in those things. The primary license of acupuncturist is expanded, probably because this person has continuing medical or continuing education units that they've taken over the course of their practice. And so we want to make sure we capture that because it means more billing, more codes, more billing. So it expands the amount of things you can file claims for. So scroll down a little bit, Kelly. Most practitioners in the category of acupuncture and the ones listed above don't have sufficient codes in CPT or HCPCS. And the acupuncture codes that are there are a little bit vague and misleading. So we provide ABC codes to really specifically describe the service rendered. And then you can put the right price next to it. If you have vague codes, it's hard to bill for the service. So our codes fit into a claim as the claim is being filed. We use the CPT code. You'll see the 99499 a lot, which is an unlisted procedure. We use that code in the standard claim where coding goes, and then we supplement ABC codes in an area that most people don't know how to use. Keep scrolling down, please, Miss Kelly. The other thing that we do is we really strongly tie the diagnosis to the procedure, because a lot of people don't know or don't do that correctly. And that's where you run into issues with the correct coding initiative, which is over 2 million pairs of codes that can't be used together. And if you do, you're going to get your claim rejected. So we want to avoid all of that rework and help you put together a claim in the right format in the first place. Scroll a little bit further down. The other thing we do is we simplify the process. For example, if you're treating somebody for pain, there's 24 different codes for pain. And if you indicate that pain is the primary reason for the visit, or use the letter A to indicate primary reason for the visit, then you can mark A every place on the body where pain exists for that visit. And then the biller can come along and code it down to the specific detail that the insurance company requires. Next, please. I'm going to close out of that. We train billers to read that super bill and file claims with ABC codes. Medical billers don't have any trouble understanding what we're doing, and it really helps their job. It simplifies it because they don't have to call the practitioner and say, which codes do you want to go with which diagnosis? You didn't show me that when you filed your information with me, or I couldn't read it from your SOAP notes. So we simplify this process so that precise communications are going back and forth between the biller, and so that your documentation afterwards follows the billing and everything matches, so that if you're ever audited, you have a really great paper trail to show. Next, please. So we provide other support services for up to 3 months related to claim denials and rejections. Remember, we're going to start talking to the insurance companies before we ever start filing claims. But as part of this process, we continue talking to them about denials and rejections so that we set payment precedent with the insurance companies and hopefully don't have to do that for every patient. We answer all billing questions that the medical biller may have or that the practice may have. And if we go beyond the 3 months of the engagement, these services are billed at $225 an hour. So what we suggest is if you order the practice setup package, you work quickly with us because it's going to save you money at the end. Kelly?
I'm going to tell you about a couple ways that you can get in touch with us. First of all, you can schedule a consultation with us, and you can go to our website to learn more. And you can also email us directly at info@abccodes.com. I'm going to walk you through our website. You can click on this red button, Call Us, and that'll take you directly to a calendar where you can schedule a time and a day where we're available to have a phone call with you. Or if you prefer, you can also click on Contact Us, where you'll fill out a simple form, include any questions you may have, and click Send, and that will send us an email. We can start communicating with you via email. So that concludes our webinar for today, and we really appreciate you joining us.